Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I'm super excited to have a super special guest today, Dr. David Banach. And I'm just going to let him tell us a little bit about himself and his background.
Sure. So thank you for having me on this podcast. So my name is David Banach. I'm an infectious disease doctor, and I work at UConn Health and University of Connecticut School of Medicine. In my role, I provide clinical care. So I see patients with infectious diseases in both the hospital and in the outpatient clinic. In the hospital, more acute infections. In the hospital, mostly more chronic infections like hepatitis C and HIV. I also have a role in our teaching program. So I'm one of the core faculty for our infectious disease fellowship. And I'm also very involved in some of the medical school teaching at the University of Connecticut. And then in my other role, I'm the leader for our infection control and prevention program at UConn Health. And in that role, I seem to have totally focused on COVID-19, at least in the last year. But in addition to COVID-19, we're involved in a lot of areas of patient safety, preventing infections amongst our patients in the hospital, and then also in some of our employee health infection prevention efforts to prevent infections among our employees in the hospital. So as I mentioned, right now it seems 100% COVID, but in pre-COVID times, my role was much more broad. We're all adjusting to new roles, I guess, in 2020 and 2021.
Absolutely. I'm sure everyone is knowing that 2020 was completely COVID. Hopefully, and we'll talk about like the new changes with the vaccine a little later in our conversation, but hopefully that can add a little more like glimmer of hope to 2021. But before we chat about that, you mentioned that you dabble in a lot of different things like medical student education and ID, as well as epidemiology. Can you tell the students who may be listening who don't necessarily have an idea about like the subspecialty of epidemiology, what that entails and how one can go from being an infectious disease doctor into doing some more of those things like you were saying with the hospital safety stuff?
Sure. So, I've been fortunate to have education and training experiences in both clinical medicine and clinical infectious disease, but also in public health and epidemiology. So everyone's approach is different to get into this field. My approach was during medical school, I actually did a combined program, an MD and a master's in public health. And in that master's program, I got additional training in things like biostatistics and epidemiology and kind of broader kind of public health principles. And then after I finished medical school, I did my internal medicine residency and my infectious disease fellowship. And then as part of my infectious disease fellowship, in addition to the clinical training, I got extra training in the area of infection control. My mentor in my fellowship was a national leader in that field and gave me that additional training, additional experiences on doing things like how to investigate clusters of infections within a hospital, how to sort of understand the principles of preventing infections in the hospital and more broadly. So it was kind of more of a prevention focused. And then I also did a one-year residency program in preventive medicine as well. So that was really pure prevention focused as part of my training. So, all of that kind of gave me the experience and background in both clinical infectious disease, but also public health and epidemiology that kind of brought me to where I am today, which is kind of a career that merges both fields.
That's awesome. Yeah, it's very interesting. Like you said, I do have some friends who are also ID and epidemiologists too. And it's so interesting as the way that you can come about that. A lot of people do start with internal medicine and then go into infectious disease and then join certain committees and things and learn more about it. And then some people go the research route or get an MPH or preventative medicine, like you said. But the good thing about that is that you're definitely focused on patient safety, not only from when you're actually engaging with the patient, but on the higher level as well, like helping with hospital infection concerns and like trying not to get bounce backs or hospital acquired infections. So I think that's totally cool.
Yeah, it's great. And it's very interesting. I do a mix, when the clinical work, I'm really focused on that individual patient interaction.
Mm-hmm.
And then, so for instance, I'll see individual patients either in the hospital or in the clinic. And then in the afternoon, I'll spend my time thinking about the patients from a much more broader perspective. And almost always the goals are 100% aligned, but sometimes there's some subtle differences in the way that we think about our individual patients versus factors as a whole. But, in general, I think it's a great opportunity, a great career path. And as you mentioned, there's so many different ways to get there. Lots of different training opportunities. I think the key is to get the clinical training and then couple that with extra training, either hands-on training, like you mentioned, on infection prevention and control and epidemiology, or formalized training through a master's degree. And gosh, some of the folks in this field even have PhDs in epidemiology and really understand the biostatistics and some of the fundamental epidemiology principles in a lot of detail. So a lot of different ways to get there. And, I think it's a great field. And certainly in COVID-19, it's particularly timely.
Absolutely. And you just brought it up and mentioned it earlier, as we all are aware, the big C word. So COVID has changed the way that medicine is practiced, the way that everything is done, just in terms of health. How has working in your field changed your day-to-day processes in terms of not the patient experience component, but like the patient safety and epidemiology aspect?
So it's interesting. I mean, I think, a lot of the principles that we've been emphasizing for decades on patient safety still apply. So, we look at, different layers of strategies that we use to prevent the spread of organisms within a healthcare facility. And typically, we're thinking about things like antibiotic-resistant bacteria, things like tuberculosis in the healthcare setting. And, we still have the same fundamental principles that apply to COVID-19. I think the fact that COVID-19 is so readily transmissible is an issue. And, we have to really intensify our measures so significantly. And, we have to worry about patients potentially becoming infected in the hospital, not just from like spreading organisms from patient to patient, but potentially from healthcare workers to patient. We have to worry about protecting our healthcare workers from becoming infected from the patients. And now this new concern is that, in the community, we're seeing so much spread that, our healthcare workers can affect each other. And that is something that we never used to think about with infectious disease and infection prevention, the possibility that, one healthcare worker could be infected and then infect a colleague. And that's something that we have to be thinking about too. And, unfortunately, we see how quickly COVID spreads. And, we think about it in households, we think about it in the community, but now we have to think about infections that are spreading in break rooms and hospitals and like these places that we never would have considered. So, I think it just broadens the effect that we have and our role in the healthcare setting from what we typically think about, which is patient safety and protecting employees from becoming sick at work. So it's made things much more broad and intense in a lot of ways.
That makes a lot of sense. It's like thinking of things in a whole new way where the principles are the same. It's a coronavirus, but it's just transmitted in a different way. And there's so many different factors. So not only are we thinking about like patient safety, now we have to think about our providers and who they're going home to and what they're doing and all of these different aspects and how to keep day-to-day life in the hospital working, because your workforce needs to be happy and healthy in order to keep running to save other people's lives.
Absolutely. And that's such a critical piece. In fact, we have our pandemic planning that we've been doing, mostly thinking about, things like pandemic flu. But, I think we underestimated a scenario where healthcare workers could become so readily infected in the community, and like you mentioned earlier, maintaining our healthcare workforce healthy and able to come to work has become a big challenge, across the country, across the world, because we know so many of our healthcare workers can potentially leave and become infected outside of the workplace that would force them to not be able to come to work. And then the other issue is with quarantining folks who become exposed in the community. So many different layers, which has really made the situation very complicated.
Absolutely. But there is a new glimmer of hope. And I know that we had discussed potentially talking a little bit about the vaccine today. And our group at Med School Coach did a poll on their Instagram. And so I have a few questions about you, but I want to just start and just have you discuss where we started a year ago, if you could, with vaccine development and how we've gotten to this point today, and just like a overview from what we can discuss.
Sure.
And that's a big question.
Yeah, that's a lot, but we can kind of take a look at it. And I think it's incredibly amazing how quickly things have progressed. So I think it all starts with the very early phase with the development of a vaccine. And that really started with our ability to identify the genetic sequence of a virus in rapid time. So, as soon as this virus was identified, it was sequenced within weeks. And having that information is really important because that allows us to, rapidly begin our research and development to develop vaccines. But I think the other key piece is mRNA vaccines, which I'm sure we can talk about in a little bit more detail. Yes. But this type of vaccine is a technology that's been in place for over a decade. And there's been constant focus on how are we going to bring this to light. And there's a lot of different viruses that have been studied in the past for potential use of an mRNA vaccine. But the rapid development of a vaccine using an mRNA platform is a critical part of how we're able to get to this point now, having a vaccine that's readily available. With other types of vaccine strategies or older technologies, this never would have been possible. So I think it all comes down to how quickly we were able to sequence the virus, having this mRNA technology kind of ready to go, basically, where we can just kind of insert virus into the mRNA or find what part of the mRNA we need to be able to bring that into a virus or into a vaccine, and be able to quickly produce that vaccine and begin clinical trials within months, which is really unbelievable if you think about it. So, when people ask me kind of Operation Warp Speed, what was the part that was really accelerated the most? And I think it was really the research and development piece and the production piece. Those happened so quickly, but fortunately, we have the technology to be able to do the sequencing and develop the mRNA vaccine very quickly. And I think that's really critical when we think about kind of where we accelerated. And it's also important to note, and we could talk about some of the efficacy and safety questions, but that the phase 3 clinical trial wasn't part of that accelerated process, and it was done really with a very robust methodology. But that ability to sequence so quickly and incorporate that into an mRNA vaccine is really remarkable.
I totally agree. And I think a lot of times, at least in the news and on social media, and everybody is saying this Operation Warp Speed happened potentially too quickly. And I'm thankful that you brought up the point that this isn't new. There have been research being developed for over 10 to 15 years. It's just that we didn't have all of the resources available. So with extra resources like finance and manpower, a lot of things can be processed quite quickly, quote unquote. But I want those listening, I'm glad you said that, just to know that this wasn't rushed. It was just more resources available. And perhaps this can showcase in the future for other diseases that may pop up, that if we put more resources into it, we might can find some cures.
Absolutely. I mean, I think this shows, what our capabilities are. And, just like you said, if we focus down on developing a vaccine quickly, we can do it. I also think that mRNA vaccines are going to be the way of the future. And, being able to see how quickly we can adapt a vaccine platform to a novel virus, there's going to be a lot to learn from that. And I would expect that this will be the first of many mRNA vaccines that lie ahead in the future.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to a medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. That's why more students than ever are turning to MCAT tutoring by Med School Coach. Our tutors are all 99th percentile scorers, have been through rigorous training, and can help raise your MCAT score by 12 points or more. You need every competitive advantage you can get to get into med school, so why not get one-on-one tutoring from Med School Coach? Our expert team will create a custom program just for you and help you master MCAT content where you need the help most. You'll raise your MCAT score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach MCAT tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
Yes. And since we're talking about it, let's talk about it. You mentioned there are lots of vaccines in development right now for COVID, but the two initial ones, the Moderna and the Pfizer ones, are mRNA vaccines, and it's novel technology. Can you briefly talk about the differences in the vaccines and the efficacy and things like that?
Sure. So the technology is the same. They're both mRNA vaccines. And the vaccine has a tiny bit of mRNA code that gets injected, gets into macrophages and cells, then allows the cell's natural machinery to produce the spike protein, and that stimulates the immune response. So both of them work the exact same way. I think in terms of the efficacy from the clinical trials, they're almost identical. So, I think we look at 95% efficacy for the Pfizer, 94% for the Moderna vaccine, which, those numbers are unbelievable to begin with in terms of their ability to prevent clinical disease from COVID-19. And, I think that they're almost identical. The dosing schedule is a little bit different. The Pfizer vaccine is 2 doses 3 weeks apart. The Moderna is 2 doses 4 weeks apart. And, that's how they were studied in the clinical trials in order to generate kind of the optimal immunity from each vaccine. But in terms of their efficacy, even the side effect profile, right now we're not seeing differences that are significant. Maybe once we enroll millions and millions of people, or I shouldn't say enroll, once we give the vaccine to millions of people, things might change. But at this point, based on the phase 3 clinical trial and the vaccine administration to date, we aren't seeing differences. I will point out the other difference, which has gotten a lot of attention, is the storage of the two vaccines. So the Pfizer vaccine requires ultra low freezing temperatures to store and to transport, whereas the Moderna doesn't have as strict a temperature requirement. But beyond those differences, the storage and handling and the dosing interval, they are essentially interchangeable in my mind. Although I should say interchangeable, I use that cautiously because it's important to know that if you get one dose of one vaccine, you have to get your second dose with the same vaccine. You can't mix and match the two different vaccines.
That makes total sense. And that kind of covered, and I'm just going to ask the question that was on the Instagram, but you kind of covered it. But to be clear, they asked, why are vaccines taken in multiple parts? And why could they not just give the 2 doses at the same time?
So, I think there's some immunologic basis to doing that. So the first dose sort of primes the immune system to start to produce antibodies. And that second dose is really what kind of boosts that production. So there is some immunity from that first vaccine. We think it's probably a shorter duration immunity. And if you really want to get the highest level of immunity, both in terms of the antibody response and the T cell response, you need that second dose to really boost that. It's really in the T cell production and the B cell production that's from that second dose. But there is some immunologic basis for this 2-dose vaccine, which really highlights how important it is for individuals to actually get both doses on the schedule that's for each of the different vaccines.
Absolutely. Another question is, how long is the time between when someone receives the vaccine and when they are immune?
So important question. As I mentioned, even after that first dose, you start to get some immunity. It's not going to be that maximum immunity. That does take some time. So what the clinical trials used was 2 weeks after the second dose was when they started to kind of operate under the idea that you're at your sort of peak immunity level. And that's where they started to track their primary endpoint, which was the incidence of COVID-19 disease. So they waited till about 2 weeks after the second dose. And that's about the guidance I give people in general, where your immunity is going to be kind of peaked and start to plateau. But, there is some immunity that's being developed even after that first dose. But in order to get to that sort of highest level and most durable response, at least based on the phase 1 studies, which were the dose finding studies, you really need to have about 2 weeks after that second dose.
After receiving the COVID vaccine second dose, will they still have to wear their mask?
So that is a question I get. That's probably the most common question that I get. At the moment, the answer is yes. So we are still recommending, and this is coming from CDC, that we still use the same protective measures even after we've been vaccinated. And that is, wearing the mask, in healthcare facilities, it's wearing the specific PPE for whatever situation you're encountering. Also maintaining the social distancing and avoiding gathering and other sort of higher risk situations. So right now we're doing that. And I think there's a few reasons that we're doing that. I think, we know that the vaccine is not 100% effective, right? So 95%. We also know that at this point, there haven't been enough people in the community vaccinated to feel confident that we have that community level protection. So an individual who's vaccinated and may still, there's still a possibility they could spread very low levels of virus with an asymptomatic infection. At this point, we still just don't have enough people immunized, and we have too much virus circulating in the community. I think with time, as more and more people get vaccinated, that level of virus in the community is going to go down, and we'll be able to lift up some of those restrictions. But we're just not quite there yet. But that's going to be something that everyone is going to be discussing in the weeks and months ahead. And I think we'll get to that point, but we're just not quite there yet.
Absolutely. And another question, and this is not from the poll, but for me, if you were seeing patients and the patient told you that they were not interested in receiving the vaccine, what advice would you, or what kind of conversation would you have with them?
So that's another critical piece. As physicians, we need to know how to handle these kinds of situations, because we have a lot of people that are hesitant about vaccines, and everyone has their own reason. But I think the really most important part is to really understand, and for that individual patient, really what is the concern about the vaccine, and how can we address it? Is it, they're concerned about vaccine side effects, and they're concerned about how quickly the vaccine came to market, like you mentioned earlier. And then those kinds of concerns can be addressed. I discuss these with my patients in detail. If they have specific safety concerns, or they have concerns about why the vaccine became available so quickly, we have detailed discussions on how to address those concerns. And some folks have trust issues with the medical system, and that's understandable. It may be related to their own personal experiences, and may be related to experience of friends and family in the healthcare system. And our role as physicians is to try to work with them, to try to help engender that trust and explain the scientific basis behind this, why we're recommending this vaccine, both to protect individuals, so both to protect you, my patient, but also to protect those around you. And I think those kinds of messages, and often kind of repeating those messages and reinforcing them can really go a long way in trying to help our patients who are what we term vaccine hesitant, or have concerns. So I think it all comes down to really digging into an individual patient's concerns and trying to address them as best you can.
At Med School Coach, we know that matching into the specialty of your choice and the residency program of your dreams has a dramatic impact on your career as a physician. And your USMLE score is the most important acceptance factor of all. That's why more students than ever are turning to Med School Coach for USMLE tutoring. Our tutors are all 260 plus scorers and have been through rigorous training. Plus, the average student who uses Med School Coach tutoring raises their score by 23 to 55 points. There is an enormous amount of material you need to know for Step 1 and Step 2, and Med School Coach can help you be smart about how to study. We'll create a custom program just for you. Then, we'll help you master USMLE concepts where you need help most. You'll raise your USMLE score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach USMLE tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
Absolutely. I think that's great advice. It's about kind of not making assumptions and digging into what is driving the conversation or the hesitancy, and trying to explain it and meet them where they are, and also giving them shared decision making. And maybe if they decide not to take it on that visit when it's available to them, readdressing it on the next visit, or doing a check-in so that eventually you may give them some time to think about it or more information.
Absolutely. And I think there's another piece of, seeing kind of what's happening around us in terms of people taking the vaccine. That was a big concern within our healthcare workers, that, no one wanted to be first, but people were okay. Once they saw that their colleagues were taking the vaccine, they were doing okay. I think that can go a long way too. So we support vaccine by us as healthcare workers getting vaccinated, by encouraging those around us when they qualify when they meet sort of that phase of the vaccine rollout to get vaccinated. And we describe that. We sort of promote, these are how many people have been vaccinated. Here's the data. Here's the safety data that's come out. And that data will continue to come out in terms of, the rate of side effects and, other safety concerns as we give more and more vaccine out to the community. And we went from clinical trials that included like 30 to 40,000 people to now millions and millions of people within weeks. And I think, as we get that out there, I think that will also help bring some confidence to those people who may be on the fence about getting the vaccine in the first place.
Absolutely. I completely agree. I think that you've shared so many different pearls of wisdom, and I really thank you for answering some of these Instagram questions. I think this was the first time I've taken questions from the audience. So if you guys liked it and you want to continue doing that, please shoot us some more questions and we'll find you some answers. I think that was fun. But for my final question for you, you told us a lot about like your background and now your current role in like medical education and epidemiology and infectious disease. What advice would you give to both a person who's in their pre-medical phase and their medical school phase about thriving in their journey through medicine?
So, I think a few pieces of advice come to mind. First, figure out what you like about medicine. What is it that is drawing you to go to medical school? What is it when you're in medical school that you really enjoy the most? For me personally, I knew even before I went to medical school that I wanted to have an impact both on individual patients, but also kind of the larger public health. There's a lot of ways to do that. It doesn't necessarily need to be just infectious disease. There's so many fields out there and so many career paths where you can have both that individual patient benefit from helping patients, but also affect the larger public health. So, that was my impetus for going to medical school. I knew from the beginning that I wanted a field to do that, and I always liked kind of microbiology. So that was kind of what brought me into my career path. But really think about what do I like about medicine? Do I like certain things about direct patient care? What do I find rewarding? Are there ways that I can think about a medical career that involves patient care, but maybe some other aspect, be it research, public health administration? There's the thing that I love about medicine is that there's so many different career paths. It feels almost unlimited in some ways, and you really need to figure out what works for you. And also remember that what you like now, during your pre-med phase and during your med school phase may change. And a lot of that's going to be driven by your experiences, by the people that you work with. I've been very fortunate to have some outstanding mentors that kind of help usher me into the path to get to where I am today in my current work. And really take advantage of those opportunities. If you meet a mentor, even if it's a mentor that maybe works in a specialty that never really interested you, talk to them, figure out what they like about their field. What are the aspects of their work that they really like, whether it's, related to the exact content of their specialty, or if it's more broader aspects of their career, and sort of figure out, how you're going to take a little bit from everyone that you meet and all those mentors and people that you work with and build that into your own career path. And I think you'll find that to be quite fulfilling. And just remember, it's never going to be a straight line. It's always going to be a zigzag, and there's going to be curves. And I think the best approach is to kind of go with it and treat each of those new steps as an open door to go into a new direction, and just be open to constantly evolving your career, because I think that'll help bring some good things into your future and make things very satisfying.
Absolutely. I think that that's phenomenal advice about being flexible, seeking mentors, and just figuring out your path and knowing that you may start at one point and end up at another, and that's okay. So just being true to yourself.
Absolutely.
So I really want to thank you for taking the time to chat with all of our guests, like our listeners today. And I'll give you an opportunity to say goodbye.
Great. Well, thank you for having me on. It's been a real pleasure. And, thank you all as listeners for listening, and best of luck to you and your career endeavors and all that you do.
Thank you so much. And everyone else, I'll talk to you guys next week. And don't forget to hit that subscribe button. And if you think of any more questions, definitely send us some suggestions on your Instagram. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.